When I signed up to become a nurse, yes, I signed up to become a lifelong learner, but I don't think I realized that at the time I started my nursing career. As you go on your journey of nursing, you begin to realize all the things you don't know. You don't know that when you're first out of nursing school. You think you know a lot of stuff, but the longer you're a nurse, the more you realize how much you really don't know. And the longer you're in this career, the more new things are discovered, the more new medications are discovered, the more new diseases are discovered, the more new equipment and treatments there are that are discovered. And if you want to continue to do the very best for your patients, you have to learn. That's the bottom line. You have to be a learner. So nothing in healthcare stays the same. That is such a true statement. Every day when you go in, you have a different kind of patient. You may be working with different colleagues. You may be working with different physicians, and they're going to be treating the patients a little bit differently, or the patient may respond differently. So even though you're applying the same care, it's always going to come out just a little bit different. So that's one way that nothing stays the same or nothing is the same. And as I said, medicine is advancing every day. I think COVID has brought out examples of how rapidly things can change. You've seen how quickly they are trying new medications, how quickly new tests to develop have been developed for detecting COVID. I think that are just examples of ways where medicine is changing at such a rapid pace. Patient education is something I've been doing for almost 20 years now, and I think it is probably one of the foundations of nursing. It's not something you can put on a list and check off when you're finished at the end of your shift. You can't say, had to do vitals at 8 o'clock and 12 o'clock, had to educate my patient at 9 o'clock. It's not something you can just put a check mark beside. It's something you do with every aspect of care that you're giving. You're continually explaining to the patient what you're doing, and that's educating the patient. You're continually talking with them about the kind of care they're going to need when they get home, and you're continually asking, do they understand what you're saying, and helping them to learn the things they need to be able to care for themselves when they leave the setting that they're currently in. Education to me is the foundation for everything, because our goal as a healthcare provider is to get the patients out of the hospital and back into their homes and into their own setting. And the only way you can do that is if they're fully educated and know how to care for themselves.